You mentioned that you went into labor at 36 weeks with your last baby and delivered, and prior to that you'd had a yeast infection, and you're wondering if there's any correlation there. A lot of studies have been done on this very topic to find out what type of infections increase a woman's chances of having preterm labor and delivery. And so far, there have not been any strong links between yeast infections and preterm labor and delivery, or the medications that are given for yeast infections. Although if a woman has a yeast infection, whether she's pregnant or not, she should get it treated. So when you're pregnant, you go to your prenatal appointments, and that's an opportunity for you to bring up any abnormalities that you've seen. So if you notice a change in the color, odor, or consistency of discharge, this is always something that you should talk with a doctor about. There have been links between bacterial vaginosis and preterm labor, and it can cause similar symptoms, just a change in discharge. And so again, it's always worth bringing it up with your doctor, and they'll decide if you need to be treated, and if so, what medication is right and safe while you're pregnant. The biggest risk factors for preterm labor are actually preterm premature rupture of membranes, so your water breaks too soon, placental abruption, inadequate prenatal care, substance abuse, smoking, shortened cervical length, and urinary tract infections. It's impossible to say for sure what caused you to go into labor prematurely, but the best predictor of future behavior is past experience. So your doctor's probably going to watch you very closely next time you get pregnant and monitor for preterm labor and delivery. If you have more questions for me in the future, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.